Thank you for the invitation to come and present today. So I'm just going to share my screen. This is going to work. Are you seeing my screen okay?
Yes, you just need to,
Yeah.
put it into view, yeah.
Okay,
That's
perfect.
great.
Thank you. Okay, so yes, you're going to hear from three of us today. So my name's Alison Ferris, and I'm an AHP consultant at Public Health Agency and the lead for Dysphagia NI. And we're also going to hear from Clare Stevenson and Jemma Jackson, and they're going to introduce themselves when it comes to their slot. So suppose what we want to do today is have a look at what the learning outcomes are. So by the end of today's session, you should be have a better understanding of what dysphagia is and the associated health and well-being implications of dysphagia. Also understand how to support someone at risk of or with a diagnosis of dysphagia and learn how to embed best practice to support people with dysphagia. And if we've got time at the end, we're going to do just a few scenarios to help you think through the content that we cover in today's session.
Alison,
Okay.
sorry, can I just say we're seeing your presenter view there?
Oh, don't know why you're saying that.
Maybe if you stop and share again.
Yeah, stop. All right, what are you saying now? Is
Yep, that's it now.
that it now? Okay, perfect. Sorry about that. Okay, so yeah, those are the learning outcomes for today. So, oh, no, it's not going to move for me. Oh, this is working perfect. There we go now. Okay, so just thinking about dysphagia and so dysphagia is the term we use for people who have an eating, drinking, or swallowing difficulty. And really to just think through dysphagia as being everybody's responsibility. So we all play a part in helping to promote both safety and enjoyment when providing drinks, snacks, and meals, as well as providing supervision and assistance when necessary for people to eat and drink. So it's really thinking about the key issues are safety and enjoyment, because those both things are really, really important. So we're going to just have a wee look at a video, which hopefully you can let me know if you can hear the sound, and which describes really what dysphagia is.
Eating, drinking, and swallowing difficulties. Many people think that eating, drinking, and swallowing difficulties are limited to older people. Many people are worried or embarrassed about their difficulty. People can feel different and excluded at mealtimes. It's estimated that eating, drinking, and swallowing difficulties can affect 27 to 40% of babies born early, 25 to 45% of a typically developing children's population, 40 to 78% of stroke survivors, 8% of adults with a learning disability, 50 to 75% of people living in a nursing home. Signs of difficulty when eating, drinking, and swallowing include choking or coughing, a gurgly, wet-sounding voice after eating and drinking, repeated chest infections or weight loss, tiring easily during meal times or feeds for infants. Eating, drinking, and swallowing difficulties can result in choking and may lead to death. The good news is that there are many healthcare professionals who can help you live a healthy life with a swallowing difficulty. Speech and language therapists are qualified professionals who work as part of a team to support babies, children, and adults to eat, drink, and swallow safely. So how can a speech and language therapist help you? They do this by providing an assessment of your swallowing, recommending exercises, swallowing techniques, and helping you to decide the most suitable food and drink textures for you. It's really important to consider the nutritional quality of your foods. Dietitians will work with you to help you decide the right food, nutrition, and drinks for you based on your needs. Healthy oral health is essential if you're having problems chewing or swallowing. Your medical team and healthcare professionals have the right training to ensure that you get the help you need. So, if you have an eating, drinking, and swallowing difficulty that does not go away, do not delay. Get in touch with a healthcare professional. Eating, drinking.
Okay. So that wee animation just gives you a very brief overview of what dysphagia is. So if we think about the food and the digestive system and the respiratory system as being very, very closely linked. So the food pipes or the digestive pipes and the breathing or respiratory pipes are so close together that there is a risk of food and drink going into the airway when we eat or drink. And dysphagia can occur when muscles that we use to chew or swallow become weak or uncoordinated. So some people with dysphagia may have a reduced or an absent cough reflex, so they're not able to protect their airway in the same way as someone who doesn't have that reduced cough or absent cough. So let's just think about some of the things that we need to consider. So first of all, is coughing a good sign? Well, in some ways it is, and in other ways it isn't. So having a good cough reflex will protect or help to protect us from aspirating and choking when we're eating or drinking. It's also a warning sign that someone is having difficulty swallowing safely. So if they're having to cough, there's a reason that they're having to cough. But it's not a good sign because it can be very unpleasant. It can be an unpleasant experience, and having a coughing episode can be really frightening or embarrassing for people and can significantly impact on the pleasure that they associate with eating and drinking. So, eating and drinking something we do every day, and quite often it's linked to things like celebrations or socializing, going out for coffee with friends or family meals. So, just thinking about how unpleasant that may be for someone who experiences a lot of coughing. Then we also think about choking and aspiration. So choking, there's an increased risk of choking if food enters and blocks the airway, which then makes it difficult to breathe. Or we can also talk about food going down the wrong way, which is whenever food or drink goes into the lungs. And then this can result in potentially life-threatening medical condition known as aspiration pneumonia. So someone who has potentially repeated chest infections, may be that the food isn't getting down into the stomach, but is entering the lungs instead. Dysphagia then is always associated with a primary medical diagnosis, so whether that be a neurological, physical, or psychological condition. So we've some listed here, but there's lots of others. So things like cerebral palsy, chromosomal abnormalities, learning disability, physical disability, diseases such as motor neuron disease, stroke, dementia, head injury, and some cancers which affect the head and the mouth and the neck or the digestive tract, as well as respiratory conditions such as COPD. So it's just worth bearing in mind that those conditions can be linked to dysphagia. So thinking about dysphagia then on the impact on someone's overall health and on their nutrition and their hydration. So as I said, we all eat and drink every day. It's part of what keeps us alive, and also it's important for our overall health. So a person who has dysphagia, they may refuse food or drinks because they don't find the experience of eating, drinking, and swallowing to be a pleasant experience. So consequently, if food or drinks are refused, the person may become dehydrated. And we know that drinking less has an impact on increased risk of infections such as urinary tract infections and overall dehydration, which is something that we want to prevent. Also, poor nutrition from eating less can affect a person's cognition and concentration. It can lead to weight loss and malnutrition and also increased risk of falls. It'll also affect how quickly a wound can heal or if healing does occur, and increase your overall risk of ill health and even death. So there's the implications of having an eating, drinking, swallowing difficulty are quite significant. The video earlier talked about the importance of oral health. So particularly for people who have swallowing difficulties, inadequate oral health can increase the risk of chest infections and aspiration pneumonia. So if you think of all the nasty bacteria that may be within the mouth, and if that's aspirated into the lungs, then that can cause some more chest infections and aspiration pneumonia. So the recommendations are to brush teeth twice daily for 2 minutes, to clean the whole mouth using a low foaming toothpaste, and to spit out the toothpaste and not to rinse it. And if you have people and you're caring for people who are wearing dentures, if they're worn for eating and drinking, they should be well fitting. They should be removed and rinsed regularly to remove the food debris from them, and cleaned daily with a denture cleaner and brush to remove the residue. The QR code on this slide will take you to a link that we have on the PHA Dysphagia website. There's lots of resources on there which we will refer to as we go through this presentation. But this is the link to an education resource for people who live with dysphagia themselves, can use it, but also anyone who cares for someone with dysphagia. So it gives some of the background information and the reasons why, and some tips and hints as well to help with oral care. And then thinking about well-being and quality of life. So we talked about meal times can become embarrassing, maybe even frightening experiences for people rather than a pleasurable and social one. So some people may experience less enjoyment of family or social occasions. And we did a survey recently with some focus groups, and that was one of the things that they said was a major challenge for them if they had dysphagia, was that some of them would even avoid going to family occasions because they felt that it was embarrassing. And for the reasons we talked about earlier in terms of coughing, but also if their food looks different to others, or they're having their drinks modified, that can have an impact on their quality of life. It can also lead to a loss of dignity, loss of independence, low mood, and can potentially lead to social isolation. So it's really important whenever someone has dysphagia that we're involving them in the decision making around the foods that they like and they want to continue to eat, and the tastes and flavors that they like, to make sure that they remain as independent as possible. So not just taking on and feeding them if they actually just need some support, maybe to cut the food up, but that you encourage them then to feed themselves, and think about how you can improve the environment that the person is eating and drinking in, so that it becomes a pleasurable environment and that there's the opportunity to eat and drink with others. So thinking around deterioration, dysphagia can be very serious and can lead to hospital admissions or increased length of stay for people in hospital. And people with dysphagia can deteriorate for lots of different reasons, and it can be associated with their primary medical diagnosis as well. So if someone manifests repeated chest infections where there's no other cause or obvious cause, so for example, there's no respiratory or cold associated with it, then that's something to look out for. And deterioration can be acute or gradual. It can even be life-threatening if not recognised or help isn't sought promptly. So we're going to just talk now about the stages of swallowing. So what actually happens when we eat and drink. So swallowing is a complex process, and it involves many parts of the brain. It involves many muscles, and we know that we swallow about 900 times every day. So if you think about that, if you're having difficulty swallowing, then that's quite a lot of times to be swallowing during the day. So there are 4 stages. They're known as the pre-oral stage, the oral stage or the mouth stage, the pharyngeal or throat stage, and the esophageal stage or the stomach stage. So this dysphagia can affect some of these stages or all of the stages. So we're just going to talk through briefly each of the stages to help explain this. So we've got the pre-oral stage, and this is a stage where we start to feel hungry or thirsty, and we can smell food being cooked. You'll look at food and decide whether it looks nice to eat or not, whether it looks appetizing, and you'll decide which utensils you're going to need to eat the food. So soup, you'll use a spoon or whatever the food is. And typically you'll start to experience a flow of saliva as food and drink is brought to the mouth. So just thinking about someone who has a difficulty at that stage, we need to be sure that, or as sure as possible, that the food that's being presented is appetizing, that it smells good, it looks good, and the person has the utensils that they need to actually eat that food or drink the drink that's being provided to them. Okay, then we've got the oral stage. This is the stage where the food or drink actually enters the mouth and it's taken, and the tongue will move the food or drink around the mouth. The saliva then helps to soften or moisten the food. And you've got your cheeks, your jaw, your palate, and your teeth all working together to break down and chew the food. And that creates then a ball-like mixture of food called a bolus, which then moves to the back of the mouth, ready to be swallowed. So that's the oral stage, everything that happens in the mouth. Then move to the pharyngeal or throat stage. So as the food then it'll enter into the throat, the muscles in the base of the tongue and the throat will squeeze together to move the food to the back of the throat. And you've got your larynx there, which will lift, and the flap of tissue called the epiglottis will protect the airway. So will protect that food doesn't go down into the lungs, we talked about, so to prevent aspiration pneumonia. And then the gullet or the esophagus then starts to open to allow the food to pass through to the stomach. So this throat stage is really important for protecting the airway. And then the esophageal or the stomach stage is whenever the muscles in the esophagus or the gullet will squeeze and relax, pushing the food down towards the stomach. Okay, so whenever you're having your scone with your cup of coffee, you can think through how many stages there are to actually swallowing your food and your drink. Okay, so how do you know if someone has dysphagia? What sort of things should you be looking out for? So it's not always obvious, so it's important to be aware of any changes in a person's ability to eat, drink, and swallow, and to respond promptly if you notice any of those signs. So we're just going to have a look at some of the signs on this next slide. So things to look out for: recurrent chest infections or pneumonia, changes in colour, so in the skin colour after eating or drinking, change in the breathing pattern, eye tearing, so you know that feeling yourself whenever your eyes start to sort of water, wet or gurgly voice or breath sounds after swallowing, could be an indication that the food hasn't gone into the stomach. Loss of food or saliva from the mouth, again thinking about the coordination or the weakness of some of the muscles of that oral stage. A reduction in oral intake, which leads to weight loss or dehydration. So just monitoring what a person is eating or drinking and looking for signs of dehydration or weight loss or malnutrition. Also identifying indicating pain or difficulty swallowing. So someone may do that verbally or non-verbally. So as you know the person, you'll be able to figure that one out. Also, someone who takes extra effort or time to chew their food and to initiate a swallow, or it takes them a few swallows. So that would result in a longer meal time, and then thinking through a longer meal time, does the food get cold? Will the person want to continue, will they want to finish the meal, or should they have smaller meals more regularly? So it's those sorts of things to think about. The food sticking in the mouth or in the throat, coughing, gagging and or choking during or after food or drink, and nasal regurgitation where the food comes down the nose. So again, we talked about the PHA website, and on there's lots of resources for people to use, and one of them is the observational checklist. So on here, it'll ask questions where you can identify yes or no and make a comment. So for example, coughing during or after meals or drinks, choking during or after meals or drinks. It looks at recurrent or regular chest infection not accompanied by the symptoms of cold. Change in voice quality. So it's all the things that we've talked about. It helps you to identify yes or no, and then make some comments. And this is the QR code on this slide if you want to access this observation checklist as well. So what do you do if you notice someone does have these signs? We would say that you should speak to a healthcare professional. So for example, nursing staff, speech and language therapist, medical staff, or a dietitian. And a referral to speech and language therapy for assessment can be made using your local processes. Okay, so when speech and language therapy sees someone for an eating, drinking and swallowing assessment, they may need to put some recommendations in place for that person. So I'm going to just play this little video, which is going to talk to you about what REDS are. So REDS are the recommendations for eating, drinking and swallowing. Hopefully this will work.
Recommendations for eating, drinking and swallowing, REDS. Following a specialist assessment of swallowing, a speech and language therapist will complete a recommendations for eating, drinking and swallowing REDS document, which specifies the eating, drinking and swallowing needs for anyone with dysphagia. If you're involved in caring for, serving, or assisting anyone who has eating, drinking, and swallowing difficulties, then you need to be familiar with this information. This is where you'll find information such as a description of the consistency of drinks that are recommended, a description of the consistency of foods that are recommended, any supervision level required, and other additional information for the person. This is a very important safety document. It is used across all care settings for all service users with eating, drinking, and swallowing difficulties and who have been assessed by the speech and language therapist. You must always refer to the speech and language therapy red sheet to check and confirm the correct consistency of drinks and the texture of all meals or snacks before serving to or assisting someone to eat or drink.
Okay.
Recommend
Okay, so that gives you an overview of REDs and things to be mindful of. Important notes in relation to REDs are that they should be recorded in the patient's notes or electronic record and should be visible within the person's environment so that everyone who is caring for someone with an eating, drinking, swallowing difficulty is aware of the recommendations. So it should be communicated to all relevant staff at all times, particularly when a person moves facilities or is discharged or goes out to the care of others as well. So robust communication and mealtime systems must be in place to ensure that REDs are communicated and implemented effectively. Okay, so the last section that I'm going to look at very briefly is around eating and drinking with acknowledged risks, which is known as EDAR. So eating and drinking, despite this is a definition of EDAR, sorry. It's eating and drinking despite the associated risks from having dysphagia. These risks may refer to aspiration, malnutrition, dehydration, and choking. An EDAR may previously have been referred to as risk feeding or feeding at risk. However, both these terms are now redundant. So we're using, this is the regionally agreed terminology, is eating and drinking with acknowledged risks. So who eats and drinks with acknowledged risks? Now this slide is very busy and do apologize. Hopefully you can see it. So when we're talking about EDAR, we're talking about eating and drinking with acknowledged risks can be applicable to various scenarios. So where there is no safe eating, drinking, or swallowing recommendations identified, where an individual with capacity who understands the risks of partially following or not following speech and language therapy recommendations made in relation to eating, drinking, and swallowing, so they choose not to follow the recommendations. For an individual who lacks capacity, a best interest decision is made to either partially follow or not follow SLT recommendations made in relation to their eating, drinking, and swallowing. An individual who is nearing the end of life, where the focus is on quality of life, or an individual who has capacity and declines clinically assisted nutrition and hydration, or an individual who is meeting their nutritional requirements via clinically assisted nutrition and hydration, but still chooses to eat and drink with acknowledged risks for pleasure. And for those where the risks of clinically assisted nutrition hydration outweigh the benefits, or clinically assisted nutrition and hydration is not clinically indicated. So we're hoping to be able to launch some regional guidance in relation to EDAR in the next few months. It's in its final stages. So once we have that, we will share it with you. And my final thoughts around EDAR are that EDAR decisions should be patient-centred. They should be discussed with the multidisciplinary team. They should be documented and shared with anyone involved in the person's care and reviewed when required. Okay, I'm going to hand over to Clare to introduce herself. I'll stop sharing and pass over to you, Clare. Thank you.
Hello folks, how are you? It is absolutely yonks since I've used Zoom, so bear with me for a wee second till I get this done. Let me see. That's not what I want to do. Hang on. Share sound. That one. Share. Okay, so hopefully you can all see that wee screen now. Okay, so I am going to be talking to you first of all this morning about myself. I am Clare Stevenson. I am a dysphagia coordinator in the South Eastern Trust. So each of the trusts has a small dysphagia support team who can be there to answer any queries, questions or concerns that you have. If you can make contact them directly within the trust that you work in, or if you have a specific query about an individual patient and their REDS, you would contact the speech and language therapist named on the actual document. But I'm going to talk to you this morning about IDSI. So hopefully you've all heard of IDSI more or less, or that you have some sort of general awareness of what it is. There's a lot of jargon going to come up in IDSI. It's a pretty dry topic, but I'll do my best to make it interesting and exciting for you all if I can. So the first thing just to say, let me see. Okay, so IDSI is basically an acronym for the International Dysphagia Diet Standardization Initiative, which is a very verbose way of saying that a group of interested and individuals from across the world with expertise in dysphagia, food preparation, food characteristics, got together and decided that they would come up with this framework that would be used across the world. So if you have dysphagia and you're on a level 6 diet and you go on your holidays in America, they should understand what that means. If you go to a business trip in Japan, they will understand what that means, because IDSI is international, it's everywhere. And what it basically does, it's a global standard, as I say. Excuse me, it has definitions for each of the levels. It has a number for each of the levels. There are colours associated with each level, and there are tests that you can test the food and the drink that is in front of you. And those tests will also allow you to ensure that you have prepared food appropriately for an individual. It's used in all care settings and all cultures. So, for example, when you go onto the IDSI website, some of the tests are outlined for here's how you do it with a fork, and other ones saying here's how you do it with chopsticks, for example, so that you can be culturally sensitive to anybody that you're working with, and you can direct them towards things that make sense for them. So in Northern Ireland, this is mandated for use across health and social care. So the Department of Health issued a memo way back when IDSI was first put out to say this is what we're now going to use. So it should be used across all HSC settings in Northern Ireland. And a speech and language therapist will use this terminology to make recommendations for food and drink levels on the REDS document that Alison spoke about a wee minute ago. Okay, so that's what IDSI is. This is the framework. So if this was just presented to you, it would make absolutely no sense at all. But essentially one side on the left covers the different levels of foods that there are, and on the right-hand side covers the different levels of drinks that there are. So this is a standard framework for use across the world, all right? And we'll just go into those in a little bit more detail. You can see there the drinks levels, so 0 to 4, and they talk about thin drinks, slightly thick, mildly thick, moderately thick, and extremely thick drinks. And those numbers and colours never change that you see on the screen there. They stay the same, irrespective of what setting you're in, irrespective if you're talking about a McDonald's milkshake or a cup of tea. They are the same consistency, colours, numbers, and descriptors that you'll see. Okay, and then levels 3 to 7 are the foods that you will see. So the different levels: liquidized, puree, minced and moist, soft and bite size, 7 easy to chew, and 7 regular. Okay, so the descriptors themselves are quite common sense if you actually think about them, and I'm going to go into a wee bit more detail in a minute or two in terms of what they actually mean and what the parameters and characteristics are. You can see there on that wee picture that extremely thick liquids and pureed foods are the same consistency. They have the same characteristics, and the moderately thick liquids and liquidized foods are the same consistency. They have the same characteristics, but we use the word pureed when it's food, extremely thick when it's a drink, liquidized for food, and moderately thick when it's a drink. Okay. Excuse me. So we're just going to talk about thickened drinks first of all. So I don't know how many of you have experience of making thickened drinks for people. And I'm going to say, I don't know how many of you have experience of ever tasting a thickened drink. But what I would say to you is people think, oh my goodness, I could never drink a thickened drink. They're terrible. They're awful. But the truth is, anybody who's ever had a McDonald's milkshake has had a level 3 drink. A McDonald's, maybe even level 4 actually, McDonald's milkshake is extremely thick, a very, very thick drink. And most people who buy them absolutely love them. So it refers to the thickness of the drink. Most people who have dysphagia have to use a special product, which is a powder that we use to put into a drink to make it thicker. And you'll see that you'll probably have seen Nuteless or Thick and Easy or those kind of products in a person's own home if you work in their own home or in the hospital with them. So they are powders that are added to the drinks, and they must be prescribed for the individual use. So although thickeners can be bought over the counter, they are a prescribable product in the UK. So an individual will have a prescription, it will have a label on it with that individual person's name on it. Adding thickener to drinks, and sometimes thicker drinks in general, can make things easier to swallow if you have dysphagia, because the liquid, common sense here folks, moves more slowly. You know, if you rolled a barrel of level 4 down a hill and a barrel of level 0 down a hill, the level 0 is going to reach the bottom way before the level 4 will. And that just gives people a little bit of extra time to coordinate all of those muscles that Alison mentioned earlier on, get them into the right position for a safe swallow, get the wee lid closed over, get the larynx moved up and out of the way, get the tongue pulled back. All of that can happen with a little bit more time. So they're not always helpful though, and I would say there is this concept around that thicker's better. That's not always the case, and for some people it can actually make their difficulty a little bit worse or put them at extra risk of having complications if they aspirate the thickened fluids. So always follow the reds, because that will be the expert opinion of the speech and language therapist around what is safest for that individual. So just be very careful, as I say, with that. And on the back of the reg, you will find a little bit more of an explanation of what the thickness level is and things like that. So if you just look out for that, go to the back of the document if you're not quite sure and you want a wee bit more information. So, and just to mention, I don't know exactly who's on the call today, but if any of you are working with young children, you won't be using the like of Nuteless or Thick and Easy with very young children because it's not licensed for use in young people like that. So, I was going to say next slide, please there. I'm used to other people presenting for me. So just to talk you through then how to thicken a drink, the first thing you've got to do is measure the drink out, all right? So all of the instructions from the manufacturers of thickeners will say, use as many skips for this amount of fluid. It's normally 200 mils. So in the early days of using this with someone, or if you're using different cups all the time or whatever, you will want to measure the fluid out. You'll need something that can show you whether it's 200 mils or 400 mils or whatever it is. But if you have a cup in a person's own home where they always use the china mug with a picture of the daffodil on the front of it, and you measure it once and you know that it holds 200 mils, you don't need to measure it again and again. But it's important that you know exactly how much fluid is going into the drink. You use the scoop that's provided by the tin. So if somebody switched from Nuteless with has a blue scoop over to Thick and Easy that has a green scoop, or vice versa, and you use the wrong scoop, you will be making the drink to the wrong thickness because the scoops are different sizes. It's really important to do what it says in the back of the tin, add it to the drink, mix it up, and wait for the drink to reach the consistency before you serve it, all right? So I'm just going to try and play a wee video here for you. Hopefully this is going to work. Let me see, something happened. And this is just going to show you how to thicken a drink, or no, how to test if a drink is the right thickness, sorry.
Get a stopwatch and some 10 ml slip-tip syringes. Remove the plunger from one syringe and discard. Cover the nozzle of the syringe with your finger, making a seal. Fill the syringe up to the 10 milliliter line with fluid. It's recommended to use another syringe to do this. Remove your finger from the nozzle end at the same time as starting the stopwatch. At 10 seconds, replace your finger over the nozzle, stopping the liquid flowing.
How do I stop? Okay, so that is called the IDSI flow test, and the IDSI flow test is used when you have a drink that you're not sure whether you need to thicken or not, or whether there's a drink sitting in front of the patient that somebody has thickened, but you want to check if it's the right consistency or not. So say, for example, somebody comes to you or you go to visit someone's home and they say, could you pour me out a drink of that innocent smoothie in the cupboard? And you know that they're on a level 1. You can use the flow test to see if it's thick enough already without you having to add any thickener to it. Or if someone, you go to visit someone in hospital and they've got a cup of tea sitting in front of them, and you're not sure because you haven't thickened it, whether it's the right consistency or not, you can use the flow test. So the flow test is used using a syringe or an IDSI funnel. So the IDSI funnel, it just looks like a syringe, but it doesn't have the plunger bit to it, and it's got the markings on the side. So some trusts have access to those IDSI funnels and others don't. So you might just want to use a syringe. Often a speech and language therapist or a dietitian will give an individual patient a syringe so that they can do this test at home. So they might have the equipment in the house. Okay, so that's just to give you a wee bit of awareness of that, because we're going to talk about the flow test a wee bit more in a second. All right. So just some additional tips then for using thickeners. They should be used to thicken all drinks, and they can be used on fruit juice, coffee, tea, alcohol. I've had lots of patients over the years have had thickened whiskey or thickened wine or whatever. So anything at all, milk-based drinks, and just to be aware that other things that are not drinks, but they are liquids. So if you're taking soups or you're using stock or anything like that, that you think the person needs to have thickened because they're on a thickened drink, then you can use it with that as well. So just to also mention that some drinks need special attention because they behave a little bit differently when you're thickening them. So for example, fizzy drinks, when you add the thickener and start to stir, it fizzes up like bonkers and goes everywhere. So just be really, really careful with that one, and let it release some of the bubbles before you add the powder to it. Milk, anything that's milky, so milkshake, milk itself will take much longer to thicken, and that's because of the fats in it and the lipids in it don't mix with the thickener. It's the liquid part, so they take a really long time to get to the right consistency. So literally, if you're thickening a glass of milk for somebody, you need to let it sit for 10 minutes. What can sometimes happen is people will mix it and then they'll go, that's not thick enough, so they'll add a bit more thickener to it, and then when it gets to the fully thickened, you could literally build a house with it. It's so thick, it could stand on its own, tipped out of the cup. So don't be tempted to add more thickener. Follow the manufacturer's guidelines, and it will in time get to the right consistency. Apple and orange juice, again, may take a bit longer to mix because of the acid in them. And if you're thickening coffee or tea, always add the milk or sugar beforehand, because if you mix 200 mils of tea with the right number of skips and then add 25 mils of milk, you're actually thinning it down. So just get into the way of doing that. And then oral nutritional supplements. So you'll be working with people who have are on Ensure drinks or 40-sip drinks or something like that. They should not be thickened. They do not thicken well. And there are pre-thickened varieties available. So if somebody's on an IDSI level for their drinks and they need an ONS, just contact their doctor and make sure they've got the right one. Or let the dietitian know if they need a new one. Okay, so that's just the flow test. I'm not going to go through that with you. I've already shown you a video on that, on how to do it. And we're going to go through the individual different levels now. So level 0, that to me and you, that's just a, water out of the tap. It's a normal thin fluid. It flows like water. It's got a fast rate. So tea, coffee, juice, these are all thin fluids. Years ago, you used to people talk about normal fluids, but as I say, McDonald's milkshake's level 4, and it's a normal fluid. So it's now thin fluids that you refer to. Level 1 then is a slightly thick drink. If it's a bit thicker than water, it requires a little more effort to drink, and it still can be drunk through a straw or taken through a syringe or whatever, if that's the way the person needs to take it. If you were to dip a spoon into it and then take the spoon out, there'd be a very light coating of it remain on the spoon. And it's used for people who just need things to slow down ever so slightly whenever they're swallowing to get good control. Okay, so for the next one then is level 2, mildly thick fluids. So again, it's just a wee bit thicker than the previous level. It flows quickly off the spoon, but you will be able to visibly see that it runs more slowly than a normal or a thin drink. It's mildly effortful to sip it through an ordinary straw, the wee skinny straws, not the fatter ones. It can be sipped from a cup still, so it's still a drink, it's still, sippable. And again, it might be used for somebody who needs to slow down their swallow. So, and also if somebody has difficulty with tongue control. So for example, if you've had a stroke and half your tongue's paralyzed, or you've had cancer of the tongue and have had part of your tongue removed or something like that, a level 2 drink can be really helpful in those situations because it's just a wee bit easier to control in the mouth. Okay, so again, the way to test level 0, level 1, and level 2 is using the syringe test or the funnel test, which is known as the flow test, which we showed you the wee video of there a second ago. So that's the funnel, and you can see what the different levels would be on there, and that's the syringe test then, to use the syringe instead. They're both done in the same way. All right, so the next one then is a level 3, moderately thick fluid. So again, this can still be drunk from a cup, it's still drinkable. It's when you get to the next level that you really have to use a spoon or something like that to take it with. It is difficult to suck this through a straw. So if somebody's using a straw, this can be more challenging, and you might need to search for and buy really thick straws for these individuals. It can't be piped or layered or anything like that. So this is the level where I mentioned to you that food and drinks start to have the same level. So level 3 is a moderately thick fluid, but it's also a liquidized diet. But if you tried to scoop it onto a plate, it would just splodge all over the place, because it is a liquid consistency still. It can't be eaten with a fork because it drips through. It can be eaten with a spoon, obviously. You don't need to chew it at all. It's very smooth. There'll be no bits in this at all, no lumps, no bumps, anything like that. And again, it just allows time for a wee bit of extra control in the mouth. And it's really helpful for somebody, again, who's got issues using their tongue. So the test for this is called the fork drip test. All right. So essentially, if you put it onto a fork, it comes through in dollops or strands through the prongs of the fork. So you can see an example there on the screen, where it's not running through like water would, but it's coming in sort of splodges, but it is moving quite freely through the prongs of the fork still. All right. And then level 4, very thick drinks. Again, usually you need a spoon for these, because they're quite thick, really. Can't really be drunk from a cup directly. There's absolutely no way, unless you're some sort of superhero with special powers, that you could drink it through a straw. Doesn't require any chewing. If you put it onto a plate, it would hold its shape on a plate. It wouldn't splodge all over the place like the previous level would. But again, there's still no lumps and bumps. Liquid must not separate from any solids that it's on. So if you're using a level 4, very thick gravy on a dinner or something like that, the gravy should be sticking to the meat and stuff. So you can't really pour it. And this is for people with very severe tongue control issues, or no tongue, as I say, if you've had head and neck cancer and had your whole tongue removed or something like that. But you don't have to bite it or chew it or anything like that. And the one thing you have to watch out for with this one is that it's not too sticky. All right. So foods of this level in particular, or sometimes drinks, can get very, very sticky. So the test for this one is the spoon tilt test. So when you put it on the spoon, it kind of holds its shape, but when you turn it on its side, it dollops off very easily, but continues to hold its shape. So it's not sticking to the spoon. You can see that. Coming off very clearly, and it's holding its shape. It's staying in that cohesive pattern that it was in. Okay, so I'm just going to show you another video. Hopefully this is going to work.
This video demonstrates how to thicken drinks for people with dysphagia using food and fluid thickener. When serving thickened drinks to our clients, we use a variety of cups, beakers and glasses. Without measuring, it is impossible to know just how much each of these hold. Never try to guess the amount of liquid in a cup or glass before thickening. To prepare a thickened drink correctly, you will need a jug or container to measure the exact amount of fluid required for thickening each IDSI level drink. Alternatively, you may use a dysphagia cup or measuring container provided by the manufacturer. To make a thickened drink correctly, you will need a tin of food and fluid thickener, a dry, clean measuring cup, jug or container. You will also need a dry, clean fork and a drink to thicken. Before using a food and fluid thickener, always check the product is still in date and is prescribed specifically for the client you are serving. Before preparing a thickened drink, always confirm the correct IDSI level drink recommended for that person. If they have been assessed by a speech and language therapist, this information will be clearly specified on the SLT Recommendations for Eating, Drinking and Swallowing, more commonly known as the REDS document. Open the tin and locate the measuring scoop inside. Take note, the shape and size of a scoop may differ depending on the brand used. You will see the number of scoops required to accurately thicken drinks to each IDSI level clearly marked on the side of the tin. Remember, not all thickeners are the same, so you must pay close attention to the manufacturer's mixing instructions. For the purpose of this demonstration, we will thicken a drink to an IDSI level 2, mildly thick consistency. Level 2 drinks can be sipped from a cup, but it takes some effort to drink them through a straw. Add the required amount of thickener to an empty, dry cup or glass. Replace the scoop and lid as soon as possible to keep the product dry. Then add the pre-measured drink to the dry powder quickly and stir briskly with a fork for 15 to 30 seconds, or until the thickener is fully dissolved. You must leave the drink to stand for 1 to 4 minutes, or until it has reached the desired IDSI level. Before serving, stir the drink gently for another 5 to 10 seconds to ensure the consistency is correct and that no lumps remain. When thickening all hot or cold drinks to any IDSI level, Strictly follow the manufacturer's mixing instructions, repeating all the steps shown in this demonstration. Please remember, food and fluid thickener presents a serious choking risk if it is eaten in its original powdered form, so it must be stored securely, out of the reach of vulnerable adults or children.
Okay, so now you're all experts on making thick drinks for people, which is great. But if you do, as say, have any questions at all, refer to the back of the tin or contact your speech language therapist or dietitian for information. So I'm going to move on now just to the food part of the framework. So if you remember, this is from levels 3 up till level 7 regular diet. And again, this is going to depend on their dysphagia and what the speech language therapist has recommended. And that information will again be included on the REDS, and it will be on the back of the REDS document if you want a little bit of further description. But also there is an IDSI website that, and if you can go on anytime you have any information or any queries, anything like that, there's a frequently asked questions section, there's a patient resource section and things like that. So anything you need will be on there as well. So just going to start off, I'm going to go through these a bit more quickly because I'm just conscious of time. A level 3 liquidized diet. So we've already talked about level 3 fluids. The characteristics are exactly the same for the level 3 liquidized food. Essentially, it is a thick liquid diet. It's not very often that people will be wanting to use this. Speech language therapists don't use it very often, but very occasionally somebody with a very severe dysphagia will come along and they will need a fully liquidized diet, fully liquid diet, but it's not liquid like water. It's thicker than that, okay? So that's level 3. And again, we've already mentioned that the test for this is the fork drip test, which we outlined a wee bit earlier. And level 4 then is pureed food. And again, this refers to the same level as the level 4 extremely thick fluids. So pureed foods, they don't need you to chew. It's very smooth texture. There's no lumps, bumps, hold its shape on the spoon. It falls off the spoon, as I say, when you use the spoon tilt test. It's not sticky. And if there's any liquids served with the food, such as gravy, sauces, coulis, whatever, they all need to be thick enough to go along with that, okay? And to stay stuck to the food, it doesn't run off separately. So that's a level 4 pureed food. And again, the test for that is the spoon tilt test and the fork drip test can both be used, and puree food needs to pass both of those tests in order to be considered the correct consistency. So again, these are not complicated tests. A fork and a spoon. Everybody's got them in their house, so hopefully it's easy enough for you to check the food before serving it to people, or advising them how to do it themselves. So again, I showed you some photographs of the spoon tilt test earlier for the level 4 fluids. It's the same thing. So it should dollop off when you turn the spoon off its side, or a very quick flick of the wrist, but not a really hard shake trying to get it off. That means it's too sticky. Okay, so level 5 then, minced and moist. So again, the clues in the title. This food is minced and it's moist. So it's used for people who have difficulty biting food off from other foods. So taking a bit of something, and also might have a limited chew capacity, but do have some chewing skills. So they need their food to be pre-prepared to this level. So again, it's soft, it's moist, but there's no liquid leaking out from the food or running off from it or anything like that. Biting is not required, but a limited minimal chewing is. For adults, the pieces of the sizes are 4 millimeters by 4 millimeters. They can be up to 1.5 centimeters long, but they can't be 4 millimeters, more than 4 millimeters in any other direction. So in children, that's 2 millimeters. because obviously children's airways are smaller than adults, as are their mouths. So it just takes a little bit of pressure to mash this food up, and you should be able to scoop this food onto a fork without anything dripping off it or falling off it. It should stay fairly cohesive. So the test for the level 5, again, just reiterating, 4 millimeters for adults, 2 millimeters for children. A really good little thing to know for adults is that if you look at a standard fork, 4 millimeters is the space between 2 of the prongs. So 2 of the prongs next to each other would be 4 millimeters between them. So if your food particles fit between the prongs of the fork, they are the right size for level 5. And the other thing is the spoon tilt test again. So again, it should not stick to the spoon, and it should come off in one cohesive lump or bolus, if you like. Okay. So then level 6 is soft and bite-sized. So again, it does what it says in the tin. This food needs to be soft and it needs to be bite-sized. So the one thing I would say to you though is it's not the kind of bite that my husband takes, which is half a slice of bread in one go. It's a little small dainty bite. So this for somebody again who can chew a little bit more than the previous diet level. It's soft food, it's tender food, and it's moist. But again, there's no thin liquids running off it or anything like that. You can see the image there on the screen. They're small pieces. People can get away with this diet if they cannot bite a big piece off. So if you took a lamb chop in your hand and bit a piece off, that's not a level 6. Because if you have to bite a piece off, it's not level 6. The ability to chew the pieces is required, obviously. And as I mentioned, the bite-sized pieces for adults are 1.5 centimeters by 1.5 centimeters. So 1.5 centimeters squared. And for a child, it's 8 millimeters squared. And again, that's to do with the size of the airway and the size of the mouth. The food should be soft enough that you can squeeze it with a fork, and you don't need a knife to cut this food up because it's already pre-cut essentially, which you can see there in the image on the plate. And the test for this is to see if it's soft enough. You're going to use a fork pressure test. All right, so for the fork pressure test, you basically push down on the food with a fork until your fingernail goes a wee bit white. So that's how much pressure you're going to use. And then when you release the fork, the food is squished and it stays that way. So it doesn't bounce back into shape. It doesn't maintain much of its original shape. It's completely modified by the fact that you've pressed down on it. That's how you know the food is soft enough. All right. So the other thing then, as I say, for adults is that it's 1.5 centimeters. And useful to know for this one is that if you have a standard fork, from the outside left-hand prong to the outside right-hand prong is usually 1.5 centimeters for most standard forks. So you can measure the pieces of food just using a fork, and that's how you'll know if they're the right size or not. And then obviously for children, they are half that size. So it should go to the middle of the fork from an outer prong. Okay. That's level 6. And level 7, easy to chew. So level 7 easy to chew foods are foods that are just the regular sort of everyday foods, but they're soft choices from what any of us would eat. And you can eat them in any way at all. You can use your fingers, forks, chopsticks, etc. There's no restriction to the size of piece, because the most important bit about this food is that once you get it into your mouth, it's easy enough to chew. There's no toughness to it. It doesn't take a lot of grinding between your teeth or anything like that. So there's no hard, tough, chewy, fibrous foods. Anything with a stringy texture, you have to avoid pips and seeds and bones, gristle and stuff like that. This place should be able to, people on this level can bite off. So if you can imagine something soft, like a bit of omelette, if they left a piece on their fork that was too big, they could take a bite off the piece of omelette. That's pictured there on the screen. So they will be able to chew it. And again, there should be no bone, gristle, hard pieces or anything like that included, because obviously they don't meet the criteria for being easy to chew. And you may find at this level that people can start to introduce mixed textures of food. So all the previous levels say no mixed liquids and solids. So if you imagine cereal with milk, vegetable soup, those kind of things, so it'd have a liquid and a solid together. They're not included on all the previous diets, but at this level you might start to see that they can introduce those. All right, and again, to test if something's soft enough, you can do the same test as for level 6. So press it down with your fork till your thumb blanches, and when you take the fork off, it's squished. Or you can use the side of the fork and press it through the food. If it goes through, it's soft enough. If it doesn't go through, it's tough, too tough, and is actually part of this diet, which is a level 7 regular diet. So level 7 regular diet is everything you can possibly imagine. All foods of every texture will fit into level 7 regular diet. Okay, so there's no tests or anything for that because it just is what it is. Okay, just to mention transitional foods. So transitional foods are foods that when you either change the temperature or add moisture to them, they change their texture. So the classic example of this that we always get questions about, especially at this time of the year and this kind of weather, is ice cream. Ice cream is a transitional food. When you look at it on the plate, it might look solid, but when you put it into your mouth and the heat of your mouth and the saliva in your mouth gets mixed with it, it turns into a thin liquid in most cases. So be very careful of transitional foods. Your speech language therapist will put this on the reds if an individual can have transitional foods. Okay, and just to mention then that there are some caveats to all the levels, which are high risk foods. So I'm not going to go through that whole list with you there. They're quite common sense, a lot of them. Hard, crumbly, anything with pips or seeds, tough or chewy, skin, bone, gristle, anything sticky like marshmallows. Everybody thinks they're great because they're soft, but actually they just would absolutely block your airway in a heartbeat. Anything that's juicy can be difficult because when you bite into it, the juice releases and the juice is a thin fluid. Dry foods, stringy, floppy foods, crispy and crunchy foods. So these are foods you need to be really, really careful of with anybody who's on a modified diet, and you either avoid them completely or you especially modify them, paying particular attention to how you prepare them so that they become suitable for the type of diet that the individual is on. So just to be very wary of those. And just a wee word about bread. We love our bread in Northern Ireland. The bread aisle in Northern Ireland is one of my favourite places ever. Wee bit of Vita, wee bit of soda, wee bit of crusty, wee Belfast bap, all the rest of it. But they're an absolute nightmare for people with dysphagia. Bread in itself is only included on a level 7 diet. It's excluded from all of the rest of the diets unless it's specially written on the reds that they can have it, or that it's especially prepared. So you can prepare bread using a soaking solution to make it appropriate for some of the lower level diets, but a lot of attention needs to be paid to that and preparation needs to go into that. Okay, so we have a wee quiz at this point. Alison, can you put quiz number 1 on?
Yes, if you just give us 1 wee minute, please.
Okay.
Just there's a sharing issue here, so.
Okay. Do you want me to move on to the next wee slide and I can cover it, and then I'm just wary of time. Gemma's still doing her bit.
Sorry, Rebecca's just making me host now, so there it is. It's up now, so it is. So let's have a little look and see if this works for us. There we go.
Okay, folks, so if you can just fill in your answers to the questions that come up, work your way through that on screen. We'll give you a few minutes to do so, and then we should start to see some of the answers coming in. So these questions are all about the different IDSI levels that we've just talked about. And I can see that only a couple of people are filling them in so far. So I'm thinking that it must be pretty difficult to engage with for folk, depending on what your device is that you're on. Okay, I'll maybe just start to go through the wee questions actually, because although I can see some answers are starting to come in there. So first one is that level 6 requires the ability to bite a piece of food off. So that's false. If you think back to level 6, it's the one that's all chopped up into the 1.5 centimetre pieces. So you don't actually need to take a bite off anything bigger. Anyone can eat transitional food. Yes, that's false. So everybody's getting that right so far. Transitional food has to be mentioned on the reds in order to be able to take it. Your level 4 liquid, sauces must not separate from solids. So again, that is true. People are getting that correct. Well done. Level 6 bite-sized pieces are 1.5 centimeters squared for adults and 8 millimeters squared for children. Correct. That is true. Red's document based on the IDSI framework should be followed all times. Again, yes, that is true. So the answer is correct there. Thickeners must be prescribed. Correct. Level 3 has a smooth texture with no lumps, fibers, or seeds. Yes, that is true also. Level 5 food is soft and moist with liquid leaking or dripping out. No, that's not correct. There should be no liquid leaking or dripping out. Level 5 pieces are 2 millimeters for children and 4 millimeters for adults. That is correct. Level 3 can be eaten with a fork. That is not correct because it drips through the fork. Adult level 5 has 4 millimeter lumps that are easily mashable with the tongue. That is also correct. So that's the lump size piece, and they have to be nice and soft for level 5. Level 7 regular can't have mixed consistency food, e.g. cereal with milk. So if you remember, level 7 regular is right at the top of the triangle. It's a framework and it's a completely normal diet. So they can basically have whatever they want. So they can have cereal with milk. Level 7 easy chew can be normal everyday foods so long as they're soft and tender. Yes, that is true. Level 4 foods can be sticky and chewy. No, they cannot. That is false. They must not be sticky and chewy. Level 7 easy to chew can be normal everyday foods that are soft and tender. That is true. So this is just regular food that you'd find if you went out for your dinner. There would definitely be a level 7 easy to chew option on the menu already without having to do anything to it. Transitional food texture changes with moisture or temperature. That is correct. So that was the ice cream example that I give you. When it gets hot and you mix your saliva, it turns into liquid. Level 7 regular food is when you can chew all textures easily without tiring. That's also correct. True. And thickener should be kept within sight and easy reach for convenience. That is not the case. Thickener, if you eat thickening powder and happen to aspirate it, you can literally die from that. So it should be stored away from vulnerable people. Okay, so next bit then, I just want to talk to you hopefully really quickly about supervision levels. So speech and language therapists will recommend a supervision level often, but not always. We have 3 different levels: general, direct, and one-to-one. And if there is a specified supervision level, it should be delivered for all eating and drinking, and it will be specified on the reds. It is as important as the IDSI levels, and in fact, for some individuals, it's more important than anything else. So please do abide by the supervision levels on the reds, and look at the back of the reds document for additional information. Just going to mention then some safety strategies. This is the PATH poster. This is available again on the BHA website, and PATH stands for position, alertness, textures, and help. So these are the key 4 things that you can do with somebody if you're working with them or helping them to eat, drink. Get them into the right position. They should be fairly upright in their chair or in bed or standing. Alertness, they should be fully awake. Never feed anybody who's drowsy or sleepy, or encourage them to eat or drink when they're like that. Texture, we've gone through all the IDSI levels today, so you know those like the back of your hand now. And in terms of help, then we talked about the speech and language therapy supervision levels, but in addition to that, people can need other kinds of help as well, which are just things like, cut my foot up for me because I've got one paralysed arm, or butter my bread for me because I can't control the knife, or things like that. So that's just very practical help. Also just to be aware around medications. So some people with dysphagia also have difficulty swallowing medications. Mouth care has already been mentioned. It's really, really important and a big safety issue for people with dysphagia. Really important that you sort out someone's vision and hearing, because it can really help with that pre-preparatory stage that Alison mentioned for the swallowing. And the environment is really important. So just distractions, have fewer people around, and make sure that high risk foods can't just be lifted off the counter or the table. So give consideration to all of those things. And just to mention then about choking. So choking is an absolute emergency situation. You literally can die from it. Some of the signs and symptoms of it are if somebody suddenly is unable to speak or talk, or they start to cough incessantly and cannot stop. They experience colour change, so you'll see them maybe going a wee bit blue around the lips or a wee bit pale initially and then turning blue. They become very anxious, may clutch at their throat, and you will need to call for help if you want to do CPR or anything like that, because it can be very intense. You follow your organisation's recommendations for what to do if someone's choking. Organisations have different approaches to this, different approaches to the level of training that they give their staff. So it's really, really important that you do what your organisation has recommended to you. Some choking incidents should always be reported as an adverse incident, whether you use a form or a DATEC system, and it may also be Ritter reportable as well if any harm has occurred to the patient as a result of the choking incident. We did have a wee quiz here, but I don't think we'll do it in the interest of time. And I'm going to hand over to Jemma now to do her wee bit. Okay, and I'm going to stop sharing.
Thanks. Now, just get this up properly. Lovely. Okay, hopefully everyone can see that now. So yeah, I'm going to just conclude things for this afternoon. Thank you very much everyone for sticking with us. I just want to kind of give you a brief overview around Mealtimes Matter and the safety pause, because obviously Clare and Alison have outlined sort of everything we need to know about dysphagia, and this is sort of thinking about in light of that, how do we keep our clients, our service users safe? So Mealtimes Matter.
Sorry, can I just interrupt you?
Yep.
You're now sharing your notes as well, so can you change it?
Okay, I thought I did that. Thank you very much. Let me see up at display settings. Is that it now?
That's it now, yes. Thank you.
Okay, lovely. Thank you. I thought I was correcting it the other way. Lovely. Thanks, Alison. So Mealtimes Matter is a sort of regional program which aims to maximize safety for service users and ensure that a high quality patient experience happens at every meal, snack and drink time. And it's everyone's responsibility. So all staff who are involved in delivering, serving and assisting patients with food and drink have a role to play. And Mealtimes Matter because people's safety, quality and their experience when they eat and drink always matters. When we think about Mealtimes Matter, there's sort of the program itself, there's sort of effective communication and safe mealtime systems have to include communication at pivotal times, a mealtimes coordinator and a safety pause. So this is a video that will outline that information, hopefully. Now, has that gone? Are you still seeing my slides or are you seeing the video?
Seeing the video.
Oh, fabulous. Lovely. Now, is the sound there? Was there sound?
Yeah, it was all good.
Oh,
Just keep going.
marvelous. Thank you. Thank you. Lovely. So that was just a little video that outlines everything you need to know about Mealtimes Matter, the Mealtimes Matter framework. Obviously, at the end of that, hopefully you picked up, you could see the food and drink safety pause poster, and you might have saw this poster in some of your care settings. Hopefully it's familiar to you. And the important thing outlined here is that before every meal, drink or snack, all relevant staff must participate in a safety pause, and that's going to be led and coordinated by your mealtime coordinator. And it's thinking about what service user safety issues for meal, drink or snack times do we need to be aware of today. And obviously our focus this afternoon has been on eating, drinking and swallowing difficulties, and that is one part of the safety pause. But Mealtimes Matter and the safety pause encompasses more than just eating, drinking and swallowing difficulties and dysphagia. We're also thinking, as you can see there, I'm going to go through them, about the environment. So in terms of the environment, you might be thinking about whether or not your service users, the area in which they're going to eat and drink, is it nice and clear and tidy? Might they want assistance with hand washing, things like that? Are they in a comfortable position? Are they sitting upright and ready to eat and drink? And maybe perhaps do they have any oxygen or additional medical needs like oxygen requirements? So thinking about the setting in which they're eating and drinking. Then, of course, we're thinking about their REDS, their recommended eating, drinking and swallowing plan. So that's considering whether or not one is in place. And if it is, have you got the correct meal, food, drink or snack available? Is it the correct level? What level of supervision or assistance does that person need? And if someone has a REDS in place, their level of supervision, as Claire alluded to, is going to be really important, just as important as their IDSI level of food or drink. So that's the red side of it. There's the 7 rights, which is just a useful little way to think about whether or not you have the right patient, the right recommendation for your eating, drinking and swallowing care plan. Is the person in the right position or posture, the right support, the right food consistency, the right liquids and the right rate of feeding? So that's with regards to dysphagia, the 7 rights. The other aspect of the food and drink safety pause is food allergies and intolerances. So just like anyone else, someone can have dysphagia and they can also have a food allergy. And unfortunately, I do know in some of our trust settings in Northern Trust, when people have both a dysphagia and a food allergy, it really further limits the variety and different kinds of meals that they can be served. But obviously it's incredibly important that we consider if they've got an allergen-free meal. And then last, but certainly not least, is considering whether or not the person is at risk of malnutrition and dehydration. So as I said before, I do think sort of the safety pause, the main thing that's often considered is the REDS, but with regards to dysphagia, malnutrition and dehydration really go part and sort of hand in hand with that. It's all part and parcel. In the next couple of slides, I'm just going to give you some statistics about the percentages of people with dysphagia that are at risk of malnutrition and dehydration. So we do want to be thinking about whether the person in front of you has their must score been completed. Hopefully you know what I mean by a must score, and if so, are they at risk of malnutrition? Do they need extra snacks? Do they need a second serving of food? Do they need extra support with regards to maybe nutritional supplements? Do they need food fortification? And perhaps they might have a food and drink chart in place that you need to complete, or a fluid balance chart, and just making sure that you're thinking about whether or not they've finished their meals, or do they need any extra encouragement. And just to say, if you've any concerns with regards to anything to do with the food and drink safety pause, do speak to your mealtime coordinator or the person in charge. We do know that often the safety pause happens really well at set meal times, at breakfast, lunch and dinner, but often it's those snack times, the beverage, the food and drinks trolleys, it's when those things go out that actually sometimes it can be overlooked, or it maybe doesn't always happen in such a coordinated way. And it may look different, at different meal times, different snack times and across different settings, but it's just making sure that you've always taken a moment to consider those 4 issues. So we all have a duty to report any concerns. So we want to encourage the person who has an eating, drinking or swallowing difficulty to tell us or another health professional as soon as possible if they have any concerns or any new issues. we want the person, we want to let the person know, the patient, if they have any concerns, or if you have any concerns, sorry, we want to let that person know, and we want to report those concerns with their knowledge so that they can get the right support that they might need as quickly as possible. And if you're using your swallow difficulties observational checklist, which is on the PHA website, you can use that if you're unsure about whether or not to refer to speech and language therapy, but don't always just assume that maybe somebody else has already done that. It's important that you check that has happened if somebody needs extra support. Thinking about incident reporting, just to touch on that briefly, we do really, it's really important that you record and report any swallow related incidents or near misses using whatever your local risk management system is. So for example, Datex. Reporting incidents isn't about placing blame on anyone for something not going correctly. It's really about learning, and it's so important that if something happens, if someone is given the incorrect consistency meal or snack, if they, for example, have a jug of water sat in front of them and they should have thickened drinks, it's really important that we don't just say, well, that's what's happened. We need to think about why. Why has that happened? You were there to intervene on this particular occasion, but you may not be there the next time. There's perhaps something with regards to the processes, with the way things are happening, that's let that incident happen. So we want to think about what we can learn, from these. And you can be sure if it's happening in your care setting or on your ward, more than likely it's something that could happen elsewhere. So we want to share that learning with everyone to minimize the near misses, sorry. And as Claire already alluded to, all choking incidents must be reported. And there is an incident trigger list again on the PHA website if you're not sure with regards to eating, drinking and swallowing difficulties what should be reported. And I'm not going to repeat this because this actually is some information that Alison has already touched on right at the beginning. But obviously, just being a dietitian, I couldn't not sort of conclude by just stressing the importance of remembering about the risk of malnutrition and dehydration that is that patients with dysphagia present with. So we know that 51% of people with dysphagia are at risk of malnutrition. So that is a really high percentage. We know that people that have a dysphagia, often they're more likely to choke or aspirate. So as a result, they're more fearful when they eat, and it takes away a lot of the enjoyment of eating and drinking for them. So as a result, then they eat and drink less, and they can lose weight and become more malnourished. And they enter into a bit of a vicious circle when it comes to dysphagia and malnutrition, because then as they become more malnourished, and lose weight, a lot of the weight they lose tends to be their muscle mass. And when we think about swallowing, obviously, as Claire mentioned, it does involve a lot of coordination of a lot of muscles within your mouth and your throat. So if you lose muscle strength, that includes those muscles in the mouth and throat. So inevitably then the dysphagia gets worse and the malnutrition gets worse. So as you can appreciate, it's a real vicious circle. Often sort of can be simple strategies, intervening early on that really makes a difference. So you can see the little image there about a nutritional action plan. Again, this information is available on the PHA's website. And I think quite soon we're going to have a food first information leaflet available as well on the website that outlines advice specifically for people with dysphagia. But you can see some of the suggestions there. A pint of fortified milk. Fortified milk is just whole milk with some extra dried milk powder added. This leaflet gives the details of how to make that if you did want to go away and look it up. But essentially it increases the calories or the energy and the protein content of the milk, so it can be used in their cereal and their teas and coffee. So that's a really easy way of getting some extra nutrition in there. Also thinking about extra snacks in between meals or at bedtime and fortifying their meals. And again, that just means, as with fortified milk, adding extra nutrition to, if they can only manage a little bit, we want to make that little bit that they do have, provide them with as much energy and protein in particular as possible. And of course, reviewing that as well is extremely important in monitoring their weight. And this last slide just outlines the percentage of people with dysphagia that can be at risk of dehydration. So 58 to 75%. I'm sure it comes as no surprise to a lot of you who have cared for people with a need for thickened drinks that people with thickened fluids are less likely to meet their daily fluid requirements. And there can be a multitude of reasons for that. I could probably talk for an hour and a half on just malnutrition and dehydration with regards to dysphagia. So without sort of considering all the reasons behind it, we do know that they're at increased risk. They're less likely to drink enough across the day. And again, it's just thinking about simple strategies, trying to offer as much of a variety of drinks as you can. Clare went through a few of the, things like you've got fruit juice, fizzy drinks, teas and coffees, they all count. Smoothies and milkshakes, particularly if they're already naturally thick, that can be really useful if someone's struggling with the thickener being added. And just thinking as well about the fact that often if you offer someone or if you put a drink in front of them, they might be more likely to take a few sips. Whereas if you just say, would you like a drink? They might say, oh no, it's okay. So sometimes we do know that, if it might be easier to actually offer and give the drink rather than just asking them if they want one. And just know what drinks, your service user enjoys. It could be a really simple thing, like you're maybe not making the tea or the coffee the way they like. There's too much milk in it. There's not a sugar in it. Maybe the squash is too strong or it's not strong enough. So it's just maybe making that effort to find out what their preferences are. Or maybe you're giving them orange juice and they like apple. It's just finding out what they like. And if drinks aren't finished, do offer more frequently. Could you have hourly drinks rounds? When it comes to thickened fluids in particular, they have to be taken away after 2 hours. For a couple of the thickener brands, that's their recommendation to the best of my knowledge. So you have to sort of discard the drink if it's not finished after 2 hours anyway. So it's just making sure that there's always a fresh drink available. And I think that brings me to the end. That is our staying hydrated with eating, drinking and swallowing difficulties. There's both a poster and a leaflet, again, all available on the Public Health Agency's website. So you can access that if you would like to utilise either the poster or the leaflet. Thank you very much.
Wow, thank you very much. That was a really very full and lots of information session today. And I know kind of way seemed to fly through it. We're kind of way out of time in terms of questions and answers, but do we want to have a quick couple of minutes to see if anyone has any questions for any of the ladies? Could you maybe stop sharing?
Yeah, I was just trying to work out how to do that. Sorry.
My challenge all the time.
It seems to be saying I'm not sharing. Sorry. Like it's coming up with the option to share here for me.
Sure.
So
we'll go ahead anyway.
I can't.
And we'll see if anyone has any questions. Let me see. Has anyone any questions? Now, unfortunately, because my screen has the PowerPoint on it, I can't see any hands. So maybe you just would like to unmute and
Alison, can I just say that I've put a link to the dysphagia page on the Public Health Agency website into the chat for people if they want to access it. And also if you have access to Learn HSCNI, you can do the targeted training on there, which will generate a certificate for you. So this is not a replacement for the regional training that's available.
Thanks, Alison. We do have some resources on our learning zone. Unfortunately,
you have the universal training on there, but that's only an awareness. So anyone who's working directly with someone who is at risk or has dysphagia needs to be doing the targeted training. So I think the one that's on the learning zone is just basic awareness. So you do need a wee bit more than that.
There's one question I can see in the chat there. Should it be compulsory to complete an actual incident report following a choking incident? And the answer to that is yes. The recommendations from the RTIA talked about the regional incident trigger list for eating, drinking and swallowing. You can find that trigger list on the PHA website as well, actually. So honestly, that's the source of truth for anything dysphagia. Is go and look at the PHA website and you'll see what the trigger list includes, and choking incidents are on that list. They should all be reported so that if there's any learning from them, we can share that information far and wide essentially, but also just to keep an eye on that. So I think that was Raquel asked that question. So yeah.
Thank you very much. Okay, so we have recorded this session today and we have got permission from everyone to share it. And we have a copy of the PowerPoint. So we will have to top and tail it, a wee bit of editing to be done, and we will share the link when it's available on our website with everyone who attended today. So unless there's any more questions, I would just like to say thank you to everyone.
So there is one more in the chat. Is it Trust suggesting we have mealtime coordination at mealtimes? So the I'm just jumping into an answer because I know we're under pressure for time. Jemma, if you want to come in on that because you talked about it, but the Mealtimes Matters framework is a HSC framework, but it is widely accepted that it's best practice, and that's why there is a framework for HSC that includes a mealtime coordinator. So it's a recommendation rather than a mandatory thing as such. Jemma, do you want to add anything else to that?
I don't think so. I think Claire's kind of summarised it. Essentially, it was sort of seen as a way of sort of formalising what we think people are already doing and trying to make the process easier. And we want to make it easy for staff to do the right thing and make it difficult for things to go wrong. So hopefully, as I say, it can look different in different settings. It depends on where you work as to what a food safety pause will look like. But yeah, it's I think Claire kind of summarised really that answered the question. So.
Yeah, here in the chat, just to make sure there's no more before I finish up for today.
Nothing more coming in that I can see anyway.
No, well, I think, and if anyone has any further questions, if you drop us a wee line, we will pass them on to the girls and we can get back to you. So thank you very much. Oh, no, something's popped up in message, but it's
So thank you.
Thank you. Okay, so thank you very much, everyone, and have a lovely Tuesday afternoon.